Here to tell us what this means from Auerbach and Gusson Insurance and Financial Services is Craig Gusson. Good morning. Thanks for being here.
My pleasure, Lauren.
This is always important because there are so many questions surrounding open enrollment time and covered California insurance, what that means. So why is open enrollment important and who needs to be aware of this?
Anybody who has insurance is going to have some kind of open enrollment probably the last quarter of this year. And for individuals with Covered California, a lot of people get a subsidy, which means the government is giving them a tax credit because of their income. And they need to go and make sure that their income is going to be about the same. And if it is, they should be in pretty good shape. If it isn't, they're going to want to meet with their health insurance agent and go over and make sure and find out exactly what the cost is going to be so they know and there's no surprises. Copays, we're going to see doctor copays either go up or down $5. The most you can pay out of pocket in a calendar year is going to go up or down $500 depending on your plan. We're seeing rate increases across California about 8.7%. If you have the most popular plan, which is a silver plan, and you're getting a subsidy from Covered California to help pay for the cost, you're probably seeing about a 2-3% rate increase. Not big. If you're not getting a subsidy, you're going to see a rate increase. The biggest rate increase we're seeing is the bronze plan. Anybody that has it knows because you get 3 doctor visits for $75. That is having a rate increase of almost 30%.
Wow, why is such a high increase for that
We
plan?
think it's, from what I understand or what I've been reading, it's because of the utilization was a lot higher than the insurance companies anticipated.
Funny
so
how that always works out.
Yeah, so that's how we're working on it. I think the biggest thing that you and I were just talking about is how I didn't realize until now that a pharmacist cannot tell you that if you pay cash for prescription that you could save some money. I've always said it on here many times. But now a law was passed in Washington, D.C. and also in Sacramento that says a pharmacist is allowed to do it. And in California, they took it one step further and says you can recommend it. And on top of that, that will go towards what the max amount of pocket you can pay in a calendar year.
Okay,
so it helps. Yes.
So people at home, in case they kind of missed that, you can save a significant amount of money on your prescription medication if you pay cash for it.
So when I walk into a pharmacist and get my prescription, I've always gone to either Costco, Walmart, or Vons, and the reason is because they have these great cash prices. And I say, here's my prescription, I'm paying cash. And 9 out of 10 times, you're going to pay anywhere from $4 to $10 for a prescription, versus going in and giving your health insurance card.
And that's regardless of whatever insurance plan you have, right? That's across the board. So whether you're Covered California or you have an employer health plan, you should always pay cash if you can.
I always. And if they say to me, you know, well, that prescription is going to cost $40, and I go and I give them my health insurance card. But up to that point, I pay cash, and you can get prescriptions for as low as $4. And for a 90-day supply, you know, you're paying $12 to $15. And your $15 is normally what your copay is for a 30-day supply with using insurance. So you want to be a good consumer and you want to understand that. Now it's going to get better, but always say what's the cash price and compare it.
Definitely.
When it gets to brand name prescriptions, totally different animal. Use your health insurance card. But for generic, which most of us take,
a smart thing to do.
It's a smart thing to do.
Okay, so what about the people who, I'm sure you hear this argument a lot, I'm healthy, I don't need insurance, I'm going to pay a penalty and not get insurance?
Great question, because if you remember, President Trump said no more penalties.
No more penalties.
So as of January 1st, if you do not have health insurance, you won't have a penalty. However, I was on here a while back, and you had someone from the IRS here. And I asked that question, and he said, yes, there won't be any penalty, but in the future, if they change that and they go back, there could be a penalty, possibly. However, understand something. If you get sick or you're in a hospital, you still have a bill to pay. And they're going to come after you. If you own a house, they're going to look at your house as a way to pay it back. So it's important to have health insurance because, you know, people complain to me and say health insurance is expensive. I go, I know it is, but so is health care. Health care is expensive. That's why health insurance is expensive. It's important to have. Find a plan that meets your needs. If your income isn't really, really high, we can show you a way of subsidizing your health insurance and getting it at a price you can afford. That's the value of using a health insurance agent. We're like the doctors in the hospitals. The insurance companies pay us, the consumer does not. So at open enrollment, use somebody because they're going to look at your situation and say, okay, what do you want? And also, if you use a narrow network, which means you only use Scripps doctors or you're willing to only use Sharp doctors or Kaiser doctors, another way of saving money. So look at all the options. If your doctor's in network, why not do it?
Yep. All right, Covered California, open enrollment
Yep.
until January 15th. No ifs, ands, or buts afterwards. So if you want to
Yep.
get it done before
Exactly.
then. Craig Gusson, always appreciate your
Great to see you.
expertise.